Remember that rash I biopsied weeks ago now? Well, I finally have all the results back. The reason it took so long was because the specimen was sent to our home lab, and they read it as basically a scab with findings of just healing and repair. And they recognized that that wasn't good enough for the biopsy, so they sent it to a specialized lab somewhere else. And that took a few weeks to come back, but that said traumatized superficial perivascular dermatitis with incipient subepidermal bulla formation. So basically, it revealed inflammation around the blood vessels in that layer of the skin, and there was also some. So bulla are blisters, like blister formation in the lower level, and that can sometimes be seen. They gave the example of like an insect bite that had persistent like inflammatory changes. Obviously that wasn't the case because this was a recurrent rash and it was in multiple places and it was just too large for a bug bite. So some other things that could cause that would be like photosensitivity rash, like if somebody got in the sun, or like an autoimmune or connective tissue type of rash, like bullous pemphigoid or mixed connective tissue disease. Lupus could do it. Everything's lupus. Lupus can do everything because it can affect every organ system. That's why if you ever watch old episodes of House, he'll always have lupus on the differential diagnosis. So because of that, they suggested possibly sending it in for immunofluorescence staining. Now, I can't make that happen personally. I don't even know where I'd go about doing that. So I'll probably have to refer the patient back to dermatology, but get the patient in with a physician this time, and I have one in mind who can probably make that happen. So we'll get him a referral to a different dermatology group that he went to the first time, and hopefully they'll be able to find the answer for him so he doesn't keep having to deal with this. I gave this update to the patient just a few minutes ago, and he told me that he's starting to have another outbreak like on his neck. So we got to get some answers to this quickly. The poor guy's suffering. So there's your update. Lots of medical jargon, but hopefully it leads us to an answer one of these days.